Joining me now to talk about all of this morning is Congressman Louie Gohmert. Congressman, it's always great to talk to you. I wish it was on something different than this issue. So I'm going to jump right into it with you and ask you this question. Do you have confidence in the CDC to have this under control? I personally don't. 77 workers were exposed to the patient. That is not even close to what the number should have been from what we've seen around the world with dealing with Ebola. They say the protocols weren't followed. Nurses now at the hospital are saying, there were no protocols for dealing with Ebola, and this is not our fault. Let me get your take.
Well, clearly there were protocols breached, but it wasn't by the nurses. It was by the CDC collectively having their heads up where the sun doesn't shine. It is outrageous that we have a CDC, and the best they can do is to blame people that get the disease for breaching non-existent protocols. If you recall, Ben, the head of the CDC first said, well, the first nurse that got Ebola clearly had breached protocol, but he didn't bother to mention exactly what protocol she had mentioned. Why? Because, again, the only protocol that was breached was the CDC, the Center for Disease Control, having their heads up where the sun doesn't shine collectively. It is really outrageous that the best they can do is not point out any specific problem that was breached, but get to the bottom of how this is being spread before they blame anyone. I mean, how can we have faith in a Center for Disease Control that immediately blames people with the disease without even knowing how they got it? I mean, you can't have faith in a group like that.
Well, the nurses group that came together to basically have this press conference in L.A. this morning, they said that the Texas hospital where that nurse contracted Ebola, now the second nurse has contracted Ebola, they said the guidelines were constantly changing, and these are their words. There were no protocols about how to deal with the deadly virus. They said the protocols should have been in place in Dallas that were not in place, and that those protocols are not in place anywhere in the United States, as we can tell right now. Now, this is coming from the National Nurses United Executive Director. She said, we're deeply alarmed by this because we feel that nurses are being put in a situation to care for patients, and it's putting their lives at risk because the CDC has not done their job.
Well, it just, I don't see how the nurses could be right when we have a president who would never lie to us, who told us that the odds of getting a case like that in the U.S. are extremely low, and even if we did, we've got the things in place that will keep it from being spread. I mean, he'd have to be lying about that. I mean, a guy that would say if you like your health care, you can keep it. If you like your insurance, you can keep it. If you like your doctor, you can keep it. Surely he wouldn't lie about something as important as this. And you know what, Ben? I think that in his own mind he's not lying. He really does believe that if he says something, then it must be true, even though there were no protocols in place, not in Dallas, not around the country, to prevent this. He just said it and expected that by saying it, everyone would be safe.
I'm not a doctor, and my guest with me is Congressman Louie Gohmert, but I've talked to a lot of infectious disease doctors, and I've talked to a lot of doctors in general that are talking about triage and when you have natural disasters and we have a terrorist attack and when they've gotten ready for biological and chemical and possible attacks in this country after 9/11, they've all told me the same thing, and that is this. They find it unimaginable that the CDC does not have a first response team to go into this situation, or if it was a terrorist attack using chemical weapons. The same way we have a response team for the FBI, we have a response team when a plane goes down, we have a response team with FEMA with natural disasters, we have a response team, multiple response teams when we have a terrorist attack. Almost every part of the government has a direct ground zero response team for any type of crisis. The CDC does not have that. And as one doctor said to me, you could have doctors all over the country that are the best at dealing with this, that would be more than willing to be on the response team because it would be the ultimate resume builder for them, almost like a reservist in the military. Why don't we have that in place where think about it, we had one person, all of America, that got Ebola. And we should have had, I believe, a response team of the best people that go immediately, I'm on a plane, I'm there, and we got this, and we're going to take over.
Well, the problem is they do have a first response team. The CDC does, but their first response team is to always jump out there and explain in a press conference why it's not their fault. Your idea would be far better to have people immediately go to where you have a deadly disease break out, especially when there's only one person. But their idea is, let's immediately do damage control. Let's get our first response team out there at the press conference, blaming the nurse, blaming others, so that we can say it's not our fault. And I'll tell you what, Ben, in the Obamacare bill, I think it was around page 1312, 1313, I kept asking the administration, what is this President's Commissioned and Non-Commissioned Officer Corps that the President can involuntarily call up in times of national, international health emergencies or national emergencies? I wish it had said national health emergencies. Are they being trained with guns? Are they being trained with syringes? What are they being trained with? Because there was money outlaid by the Democratic-controlled Congress for this new President's Commissioned Officer Corps, Non-Commissioned Officer Corps, that would respond immediately in a where there was an emergency. I still don't know what those guys are being paid and being trained to do, but the President has them, and it's time somebody reacted besides going and having a press conference. It really is outrageous. While Rome is burning figuratively with disease, the CDC is out there defending themselves instead of those who are having the disease inflicted on them.
Congressman, I appreciate your time. I know you got to run, but I hope that we get some sort of pressure from you guys in Congress on the CDC so that we can, I have a feeling this isn't going to be our last case. Living here in Dallas, seeing this, we don't have it under control, and it could easily get out of control. 77 people in the hospital.
Until the CDC actually gets to the bottom of how it's being spread, they can't say if anyone breached besides the CDC, and that's got to be key.
Great point.
And we will get the pressure on. You bet. It's already being applied.
Congressman, I appreciate the time, sir. It's good to talk to you. We'll have you back real soon.